Well, good morning.
Good morning.
I hope everybody's doing good today.
Yes.
This morning, guys, y'all are going to have Henry Diller here in this hospital room. And Mr. Diller was brought into the emergency room this morning by his wife. She states that she was awakened at 4 a.m. by Mr. Diller walking around the house, shouting that the children needed to wash their hands for dinner. When she approached him, he was wet with a strong urine odor and did not seem to know who she was. She cleaned him up, drove him to the ER, where the physician has admitted him for further observation and evaluation. The admission diagnosis is mental status changes, rule out underlying causes. You are the med-surg nurses. This is a med-surg ward unit, and you are preparing to admit Mr. Diller to the ward. You will be able to access vital signs on the monitor there on the wall. And his wife had some further comments before she left for home. She went to go get some clothes and she'll be back up for him. But she told us that Mr. Diller has always been very active, that he exercises 3 times a week with water aerobics, and he also volunteers weekly as a math tutor at their local elementary school. The ER started an 18 gauge for you. It's in his right AC. They did draw labs, but he was unable to give a clean catch urine sample at that time. So you'll need to get that from him and then send it down to lab, okay?
Okay.
And y'all need to do your admission assessment and other procedures as appropriate. Now your objectives for this scenario is that you're going to do an appropriate assessment, okay? So we like focused and we love head to toes as well. We want you to correctly collect the ordered labs, correlate the signs and symptoms of his illness, and determine the underlying cause and what you need to do in order to your nursing interventions and to keep him safe. And then we want you to understand all of the safety risks involved with this gentleman. He is 69 years old. And your weight and your allergies will also be in the electronic health record. Any questions before I pop out of here?
Not that I'm aware of.
Okay, all right, thank you. Have fun.
All right, we'll get out here and get started. Hello, Mr. Diller.
Good morning, Mr. Diller.
Good morning. Good morning, Mr. Diller. My name is Hallie. I'm one of the nurses here on the med-surg unit, and I'm going to help process your admission here to the hospital. I'm just going to verify your name and date of birth. Is it Henry Diller, date of birth 3/14/1944?
Yes.
Okay,
That's
wonderful.
me.
Okay, Mr. Diller, my name is Lynn, and I'm going to be helping Hallie out today, and I'm also be giving you your meds. Let me go see what the doctor has ordered for you.
So while she checks over your record, Mr. Diller, I just want to ask you a few questions. Do you know where you're at?
Well, yes, I'm at the Sunrise Cafe.
The Sunrise Cafe. Okay.
Can I have some coffee?
You know, I will double check your orders just to make sure that you can have some coffee. I'll see if we can get you some coffee. I'll do that. Do you know what today is?
It's bingo.
It's
I play
bingo.
bingo today.
Is today the day for your bingo? Okay, I can see you're
Yes.
kind of having some trouble with a little confusion here. Can you tell me what your wife's name is?
Oh, goodness. I don't think I remember.
That's okay. That's all right. Don't you worry about it. We'll take care of everything. For just a second here, Mr. Diller, I'm just going to kind of take a quick look at you. I'm going to look in your eyes with my little fancy light, okay?
Oh, okay.
Okay.
I did see my army buddy out there.
You did?
We've been friends forever.
Oh my goodness. Well, you know what? I will go double check and just make sure if there really is somebody out there or not, and I'll let you know, okay? So I want you to just look at my nose for just a second. You're going to have a bright light in your eyes.
Okay.
And Mr. Diller, I'm just looking at your
One more
arm.
time.
That way it looks good, and we've got Henry Diller, normal saline, and 100 mils per hour.
And I see your pupils are equal and reactive to light bilaterally. So I'm going to go ahead and take a listen to your lungs and your heart too as well, okay?
Okay.
All right, so I'm going to expose you here, Mr. Diller, for just a second because I want to make sure I can hear you and hear your heart sounds, your lung sounds real good with my stethoscope, okay? And it might be a little cold. I'll try and warm it up. You just be patient with me and I'll Be done as soon as I can, okay?
Okay.
Okay, your lungs sound nice and clear and your heart rate is nice and regular. I'm going to go ahead and check your vital signs there for a second and I'll move on with my assessment, okay?
Okay.
Okay. Mr. Diller, I just want to take a peek here at your legs because you need to have on these little wraps around your legs to be sure that it helps with circulation. We got those on.
Okay.
Okay. And when Hallie finishes her assessment, then we're going to see if we can get that specimen to send down to the lab, the urine specimen.
Oh, urine, what's that?
I'm just going to have you pee a little bit.
Oh, okay.
I'm going to slide this on your finger here for just a second, Mr. Diller.
I feel like I could pee.
Well, we're going to help get a little sample of your pee here so we can check that out, okay?
Okay.
When I put this on your fingers, I noticed you got a nice brisk capillary refill. The ED started a nice little IV in your arm. Does that hurt at all when I touch that?
Well, no, it feels okay now.
Good. It looks nice and intact dressing, and there's no signs of any redness or inflammation on that, so it looks real good. That's good. All right. I'm going to expose your belly here. I'm just going to take a listen to your tummy for a second.
Okay.
I kind of noticed that your urine or your pee kind of has a strong odor.
Oh, yes,
How long's that been
it
going
is.
on? Can you tell me about that?
I think since yesterday.
Since yesterday. Okay, hold on just a second. Okay. When, do you know the last time you had a good bowel movement?
I think yesterday.
Any tenderness at all when I touch you here?
Oh,
How about down here?
yes.
Yeah, that's a little tender, isn't it?
Yes.
Okay, well we'll get you all checked out here. Are you having any pain at all?
I don't know I don't know.
Have you ever heard anybody ever talk to you about a pain scale, or is that kind of difficult to understand?
I don't know what that is.
Okay. Do you feel like you're hurting a little bit? Is it kind of a happy day or a sad day?
I feel bad.
You feel bad.
I
Okay.
do. I feel bad.
Okay, well, we're just going to try and assess your pain the best we can with those other cues that we have here, okay? And we'll get you taken care of. All right. Are we ready for a urine sample?
Yeah, let's go ahead and do it. Mr. Dillard,
Yes.
do you think you can stand at the side of the bed?
Oh, I'm too weak.
You're too weak.
I'm
Okay.
too weak. I guess if I had some coffee, I think I might feel better.
You add some coffee. Yeah, we'll see. Once we get this urine specimen, we'll get you some coffee. I'm going to help you out here, so I'm going to expose you just a little bit.
Okay.
And I see we've got a pad underneath you.
Yes.
Get my gloves on here. And the doctor's ordered what they call a clean catch urine sample.
Yes.
And so what we're going to do is I'm going to put this little basin down here.
Oh, okay.
I'm going to open my sterile container here. Now I'm going to clean you off with some little pads here. These have soap on them, so it's going to be a little cool, okay? And I'm going to touch you.
Oh, okay.
Here it goes. Here's one. Two. And then there's my third one here. This is the last one.
Okay.
Got to make sure you're nice and clean.
Okay, do you think you can go a little bit?
Yeah, it kind of hurts though.
Yeah. Okay. I'll get a little bit here.
Here I go.
I see you started to go. Okay, hold on one second. We're gonna get a little sample midstream.
Okay.
Good, that's about all we need. I'm gonna sit it right back
Okay.
here.
You go ahead and empty your bladder, okay?
Oh, thank you.
All right.
Have you-
It hurts.
I'm
Yeah.
sure it does. Have you been drinking enough water that you know of?
I don't think so.
Okay, I have a tissue here. Let me just
There we go. Got
dry you
tissue.
off. Okay. Let me take this out. Okay, and I'm going to take that urine specimen down to the lab so they can run the UA on that.
Alright. And I'm just gonna look at your lower extremities here. Good. We've got our SCDs on, just making sure that we're have all the proper prophylaxis in place. Let's see here. I'm just gonna check out your lower extremities. Okay. Now, Mr. Diller, I know that you seem a little confused, and I just want to make sure that I let you know you're at the hospital, and you're here with some nurses, and we're going to make sure that you're safe, and we're going to try and take care of you and make you feel better. We'll get you some medicine for your pain and your discomfort, and hopefully get you feeling better here real soon. It's real important that you do not get up out of the bed without first calling for the nurse or asking for help, okay? I'm going to leave these 2 side rails up for your safety, just to make sure that you don't have any problems or any risk of falling outside the bed. And your call light is right here next to the bed, okay? And that's all you have to do is push the button to call the nurse, and I'll be right here. Okay? All right. I may consider doing a bed alarm if he has a lot of confusion or if he stays confused if I have to. I can always call the doctor for that. Okay. Vital signs are heart rate's 97, is a little fast. O2 sat is 96% on room air. He's a little tachypnic, 33 on the respirations.
Hospital.
I'm sorry, that's the untitled.
This is Lynn, may I help
That's
you?
34. That's okay.
Hi,
Respirations
yes,
are 25.
This is the lab calling.
Blood pressure
And,
102
we just want to
over
let you know
58.
your UA results are in the computer. They have been flagged, so they do need review.
Oh, okay. Thank you very much.
Bye.
Temp is 97 too. Okay, vital signs aren't too bad. A little tachycardic, just a slight tachypnic, which is probably consistent with urinary tract infection.
Oh, a laboratory. Here we go. A lab called with his lab results.
Scroll. Yeah. Corner. Ah, there we go. Oh, he's got hazy urine with foul odor, which we knew. pH is 8.4, which is fine. He's got some white cells in his urine. And, yeah. It appears he probably has a urinary tract infection.
Okay, well, I'll go ahead and call Dr. Curtis and give him the lab results.
I'm gonna look at this.
Let me look up. Let me see.
That'd be 7091.
Okay. There's his number.
KCKCC Hospital, this is the operator. Can I help you?
Yes, I would like to have Dr. Curtis call extension 7096, please.
Thank you, ma'am. We'll do it right now.
Okay, thank you.
Dr. Curtis, 7096. Dr. Curtis, 7096.
KCKCC Hospital, this is Lynn. How may I help you?
This is Dr. Curtis. Can I help you?
Hi, yes. I am calling about Henry Diller, the patient that was admitted last night with altered mental status. And I have his lab results for you on his UA.
Wonderful.
The appearance was hazy, odor was foul, pH was 8.4, WBCs were 10.
Okay. Sounds like he might have some
You're too young. Let me give you some orders. Are you prepared?
Yes, I am.
Okay, so let's do Cipro, 200 milligrams. IV piggyback every 12 hours.
Okay.
And then let's give him, is he complaining of pain or cramping?
Yes, he has been.
Okay, great. So pyridium, 100 milligrams PO, TID.
Okay.
And then Motrin, 400 milligrams every 6 hours, PRN pain.
Okay. Let me review those with you. You want Cipro, 200 milligrams, IV piggyback every 12 hours.
Yes,
Pyridium, 100 milligrams, PO, TID.
correct.
And Motrin, 400 milligrams, Q6 hours, PRN pain.
That is correct. Thank you.
Okay, thank you very much, Dr. Curtis.
Wait,
Bye.
just want to let them know that the points will count was 20.
But that's okay. Okay. Well, I'm going to go ahead and get his meds and get those going, okay?
All right. I'll make sure that his vitals are staying stable still. Reassess his vitals here. Are you doing okay, Mr. Diller?
Oh, yes.
Yeah.
Did you find my army buddy?
I was out there a few minutes ago and I didn't see him. But I won't continue to look. I just think you're probably having a little confusion. You've got a little bit of an infection in your bladder.
Well, he was sure my buddy.
Right.
During the Civil War, we worked together.
Well, my goodness, that was probably a long time ago, huh?
Yes.
How old are you again?
60
Uh-huh.
something.
We're going to get you feeling better here shortly, and everything's going to be a lot more clear and make a lot more sense here. Just give us a little time, okay?
Okay.
Okay. I'm going to review your orders just to make sure that you're able to drink and have some coffee, because you do need some fluids. We need to make sure that you have lots of water to kind of help flush some of these bacteria out of your system, okay?
Oh,
Give me just a second. Are you feeling okay?
Yes.
All
I
right.
think so.
Let me review your orders here. Sodium diet, so he's
Hello.
Hi, Mr. Diller. It's Lynn again, and I have your medicines for you.
Okay.
I brought you something for pain to help you feel a little better, okay?
Oh, good.
Do you think you can sit up to take these medicines?
Oh, yes.
Okay, I'm going to raise the head of your bed up just a little bit.
to the MAR.
Okay. Let me verify the meds.
So we have Cipro 200 milligrams and 100 mils. And then we have our Pyridium 100 milligrams and our Motrin 400 milligrams. Okay.
Okay. All right, Mr. Diller, I'm going to have you take the pills first, and then I'm going to do the other one. Can you tell me your name and date of birth?
Yes, I'm Henry Diller, 3/15/1944.
Okay, very good. Now, I'm going to give them to you one at a time, okay? It'll probably be a little bit easier for you to take.
Okay.
The first one is called Pyridium, and this is to help with kind of the cramping that you have when you pee.
Oh, yes.
Okay, and the other thing about Pyridium is it will turn your urine kind of an orange colored. I just want you to be aware of that so that the next time you pee, if it looks kind of orangey, that it's the medication that's making that urine or your pee look orange, okay?
Well, I'll be darned. I need that for Halloween.
Yeah, that would be, yeah, interesting for Halloween there. Okay, got your pill.
Thank you.
Okay, here you go. In your mouth. Okay, and here's a little water for you.
Thank you.
Did you get that down?
Good
Okay.
deal.
Next thing I have for you is your Motrin, and this is for pain. So this will help you feel better too.
Okay.
Here's your pill. Here's your water.
Go.
Okay, very good. Now, because your urine kind of had that smell and it was cloudy, the doctor's ordered an antibiotic for you, and the antibiotic is Cipro.
Oh.
And I noted that on your MAR you didn't have any allergies to any medications,
No.
so we're good there.
Okay.
But this antibiotic is going to go in your IV, and you'll get this twice a day. Okay?
Okay.
I'm just going to use your bed here for just a second. Let me get some gloves on. All right. I'll open my package and take everything out of the package. Okay. First thing I want to do is to be sure that I close the tubing, because if I connect the medication to it, then I'll lose all my medication. Okay. Let me hook this up here. And thank goodness we have needle system. Take the top off of my antibiotic, top off the tubing. I'm going to spike my antibiotic. And then I'm going to take an alcohol pad, find the port above the machine, oops, scrub the hub. Okay. And I'm going to connect my tubing to the port on the machine. Okay. Because this is a plumb pump, I can back prime it using the machine. But what I'm going to do then is lower my medication, open my clamp, and fill the tubing with fluid from the primary set. Once I have fluid in the secondary, I'll close my clamp again. I'm going to hang my secondary above the level of my primary bag. Oh, shoot. Okay. And then I'm going to program it based on my Davis drug book. I can run this 200 milligrams of Cipro that's in 100 milliliters over 1 hour. So I'm going to set my pump for secondary. Volume to be infused is 100 milliliters. Milliliters per hour, or infusion rate is 100. And then I'll start it. I'm going to open my roller clamp and be sure my fluid is dripping before I leave the room. Okay. Here's working. And it looks good, and the IV is still good.
Okay.
Okay. Now, Mr. Diller, do you want your head up or do you want it back down?
Oh, I think up is good. Thank
Okay.
you.
Well, I verified your diet, and you can have a lunch, so I'll make sure to get your lunch ordered, and I'm also going to get lots of fluids up here. I want you to drink lots of water. It's going to help help with this urinary tract infection, okay?
Oh, okay.
Okay, so just drink lots of fluid, and anytime you need help, you need to go to the restroom, if you're having any discomfort, you make sure you ring for us, okay?
I will do
Don't get out of bed without any assistance, okay?
Okay.
All right, I've got your call light right here. We've got your bed in the lowest position, and your STDs are on, your vitals are stable, your fluids are infusing. Is there anything else I can get for you, sir?
No, I think I'm okay. I sure do, thank you.
Oh, absolutely. I will be back. We'll be in here every few minutes, every 15 minutes to 30 minutes, just to check on you, make sure you're doing okay. And if there's anything you need, you just let us know.
Thank you.
Thank you.
All right, and this concludes